Let's talk about a couple of problems that people come in with that are often confusing. Piriformis syndrome can be a lot of different things, but we're going to show you a couple of techniques to add to your tool belt for dealing with piriformis syndrome, and also another problem out here at the lateral side, greater trochanteric bursitis. So let's start with greater trochanteric bursitis and describe how we know if they have greater trochanteric bursitis. They come in and they tell you that they can't sleep on that side or lie on that side for over 10 or 15 minutes and they got to roll over. That's kind of a dead giveaway. So we're going to start by putting our palm, fingers facing back toward us, on the lateral border here of the greater trochanter, greater trochanteric bursa. And we're going to push the leg into external femoral rotation and resist here. So it's a counter force, gentle at first, very, very gentle counter force. And you're checking in with your client patient, making sure that you're not triggering pain during this technique, because it can be a very, very sensitive area. I do it about that length of time right there in that direction. And then I'm going to go the other way. I'm going to push my hand like I'm pushing the tissue away. So now I'm just going to pull into internal femoral rotation. Working all the tissue around the greater trochanteric bursa to try to relieve some of the pressure on it. Tensor fascia lata, what does that do? It tightens down the IT band on top of it. So be sure and get over on tensor fascia lata and loosen that up as you go through. Okay, let's go on to piriformis syndrome. Just add that one to your tool belt. It's really simple, easy to do. The setup for this is different. You come with your back behind the client and you hook here. Sit on the table, palm up. Now, get on sacrum. I want you to be on bone. Just roll around on bone, gently, just so that you're identifying your landmark here. So, you're going along the border of sacrum, you're dropping right off, and that's the best place that you can actually access the deep six external hip rotators, particularly piriformis. Listen, I don't care if I'm doing Gamellis or any of the other deep six hip rotators. If whatever's tight along this border, I'm going to work. Okay, so here's the advantage of this position. I'm dragging the tissue down to begin with, and then I'm able to push the leg into internal femoral rotation, which does what? It tightens up the external hip rotators that you're working on. So now I can feel what's tight. Before, I couldn't, when she's up here, I can't tell. It all feels the same to me. But when you go down there, you go, oh, okay, maybe there. Maybe I like to be there. And so I'm just going to hang out there for a minute or ask her to do some sort of motion, breathing, pelvic tilting, whatever. We're not going to do that now. But any kind of activating force through there, scrub all along that border, all those deep six rotators. You're just affecting them. You're not on them, but you're just affecting them. Here's the second part of this, and this is a one I really love. Came up with in class one day. Palm is still up because you're working on with your ulna bone. Okay, you're on that same border. Everything is exactly the same. Setup's exactly the same, except this time I'm going to be lifting her into hip extension while I drag the external hip rotators down. Here it goes, rhythmically. How does that feel?
Really good.
I just love this technique. Okay, add those to your tool belt. You'll love them.